1. A nurse is caring for a patient with a draining surgical wound colonized with multi-drug-resistant organisms. What is the most important action before leaving the room? 1. Remove gloves and gown at the doorway. 2. Wash hands for 30 seconds. 3. Disinfect stethoscope. 4. Dispose of soiled linens. Answer. Remove gloves and gown at the doorway. Rationale. PPE must be removed before exiting the room to prevent environmental contamination outside the isolation area. 2. During a home visit, a nurse notices that a patient with a urinary catheter is not performing hand hygiene before catheter care. What is the nurse's best response? 1. Re-educate the patient on infection prevention. 2. Notify the provider. 3. Discontinue catheter. 4. Document noncompliance. Answer. Re-educate the patient on infection prevention. Rationale. Patient education is key in home care to reduce the risk of catheter-associated urinary tract infections, CAUTIs. 3. Which task should the nurse avoid delegating to unlicensed assistive personnel, UAP, for a patient on airborne precautions? 1. Delivering meal trays. 2. Emptying urinary catheter bag. 3. Performing respiratory assessment. 4. Assisting with hygiene. Answer. Performing respiratory assessment. Rationale. Assessment requires clinical judgment and cannot be delegated to UAPs. 4. A patient with pertussis is admitted to the hospital. What type of precautions should the nurse implement? 1. Standard. 2. Contact. 3. Airborne. 4. Droplet. Answer. Droplet. Rationale. Pertussis spreads via large respiratory droplets. Droplet precautions are appropriate. 5. After removing gloves, what is the next essential action to prevent infection transmission? 1. Document the procedure. 2. Remove gown. 3. Perform hand hygiene. 4. Leave the room. Answer. Perform hand hygiene. Rationale. Hand hygiene is required after removing gloves to eliminate residual pathogens. 6. A nurse notes that a patient's central line dressing is soiled. What is the appropriate response? 1. Document the finding. 2. Reinforce the dressing. 3. Notify infection control. 4. Change the dressing using sterile technique. Answer. Change the dressing using sterile technique. Rationale. Soiled central line dressings increase infection risk and must be changed promptly using sterile technique. 7. A nurse educator is reviewing donning PPE. Which item should be put on last? 1. Gown. 2. Gloves. 3. Mask. 4. Goggles. Answer. Gloves. Rationale. Gloves are donned last to ensure they cover the cuff of the gown and maintain the barrier. 8. A nurse observes a colleague failing to perform hand hygiene before patient contact. What is the nurse's first action? 1. Report to supervisor. 2. Confront the colleague. 3. Provide a gentle reminder. 4. Document the incident. Answer. Provide a gentle reminder. Rationale. Immediate, respectful peer correction promotes patient safety and teamwork. 9. Which of the following surfaces should be disinfected between every patient use in a shared patient room? 1. Bedside table. 2. Bed linens. 3. Privacy curtain. 4. Four-pole. Answer. Bedside table. Rationale. High-touch surfaces like bedside tables must be disinfected between patients to prevent cross-contamination. 10. What is the priority action when entering the room of a patient in airborne isolation? 1. Perform hand hygiene. 2. Apply surgical mask. 3. Apply N95 respirator. 4. Apply gown and gloves. Answer. Apply N95 respirator. Rationale. For airborne isolation, an N95 respirator is required before room entry to prevent inhalation of infectious particles. 11. A patient with neutropenia. What is the most important environmental control? 1. No fresh fruits. 2. Avoid visitors with colds. 3. No live plants. 4. Private room. Answer. Private room. Rationale. Immunocompromised patients require private rooms to reduce exposure to potential pathogens. 12. During an outbreak of norovirus in a long-term care facility, which action by the nurse is most appropriate? 1. Use alcohol-based sanitizer. 2. Cancel communal activities. 3. Provide antibiotics to all residents. 4. Isolate only symptomatic residents. Answer. Cancel communal activities. Rationale. Limiting group interactions during an outbreak helps control transmission. 13. A patient with suspected meningococcal meningitis is being transported for a CT scan. What infection control measure is necessary? 1. Place patient in isolation after return. 2. Notify radiology and provide surgical mask to patient. 3. Apply N95 to staff only. 4. Transport quickly without PPE. Answer: notify radiology and provide surgical mask to patient. Rationale: meningococcal meningitis requires droplet precautions. The patient must wear a surgical mask during transport. 14. A nurse is preparing to remove PPE after caring for a patient on contact precautions. Which item should be removed first? 1 gown, 2 gloves, 3 goggles, 4 mask. Answer: gloves. Rationale: gloves are the most contaminated and should be removed first to reduce exposure. 15. A patient with shingles, herpes zoster, has disseminated lesions. What type of precautions should be used? 1. Contact. 2. Airborne and contact. 3. Standard for droplet. Answer: airborne and contact. Rationale: disseminated herpes zoster can spread via airborne route. Both precautions are needed. 16. A nurse is teaching a patient with a new ileostomy about infection prevention. What is the most important point to emphasize? 1. Rinse bag daily. 2. Avoid touching stoma with hands. 3. Wash hands before and after changing the bag. 4. Keep stoma dry. Answer: wash hands before and after changing the bag. Rationale: hand hygiene before and after care is essential to prevent infections related to ostomy care. 17. During an indwelling catheter insertion, the nurse touches the sterile catheter with ungloved fingers. What is the correct response? 1. Use a new sterile catheter. 2. Clean the catheter with alcohol. 3. Proceed carefully. 4. Ask for assistance. Answer: use a new sterile catheter. Rationale: once sterility is broken, contaminated equipment must be replaced to prevent infection. 18. A nurse is reviewing infection control policies. Which of the following procedures requires surgical asepsis? 1. Inserting a urinary catheter. 2. Administering oral medications. 3. Drawing blood. 4. Changing linens. Answer: inserting a urinary catheter. Rationale: sterile surgical aseptic. Technique is required for invasive procedures such as catheter insertion. 19. A nurse is caring for a patient with Ebola virus. What is the most appropriate isolation level? 1. Contact and droplet. 2. Standard precautions. 3. Enhanced precautions with full PPE and negative pressure. 4. Airborne only. Answer: enhanced precautions with full PPE and negative pressure. Rationale: Ebola requires high-level precautions, including full PPE and negative pressure due to risk of body fluid transmission. 20. Which statement by a new nurse indicates understanding of standard precautions? 1. I only need gloves for blood exposure. 2. I use standard precautions for all patients regardless of diagnosis. 3. Standard precautions are needed only for isolation patients. 4. Masks are always needed for every patient. Answer: I use standard precautions for all patients regardless of diagnosis. Rationale: standard precautions are applied universally to reduce transmission of infectious agents from any patient. 21. A nurse is caring for a patient with Clostridioides difficile infection. Which hand hygiene practice is most appropriate after removing gloves? 1. Use alcohol-based sanitizer. 2. Rinse hands with water only. 3. Wash hands with soap and water. 4. Apply lotion to reduce skin dryness. Answer: wash hands with soap and water. Rationale: alcohol-based hand rubs are ineffective against C. difficile spores. Hand washing with soap and water is necessary. 22. A nurse notices a UAP using the same gloves between 2 patients. What is the appropriate action by the nurse? 1. Provide immediate feedback and instruct glove change. 2. Report to the nurse manager. 3. Document the event. 4. Ignore since no fluids were contacted. Answer: provide immediate feedback and instruct glove change. Rationale: cross-contamination can occur with gloved hands. Gloves must be changed between patients. 23. Which action best prevents ventilator-associated pneumonia in an ICU patient? 1. Elevate the head of the bed to 30 to 45 degrees. 2. Use humidified oxygen. 3. Increase fluid intake. 4. Limit suctioning to once daily. Answer. Elevate the head of the bed to 30 to 45 degrees. Rationale. Elevating the head of the bed reduces aspiration risk and lowers the incidence of ventilator-associated pneumonia. 24. A patient is placed in protective, reverse isolation. Which of the following is appropriate? 1. Staff must wear gowns and gloves when entering. 2. Visitors with respiratory infections are allowed. 3. Use positive pressure room. 4. No need for mask or gown. Answer. Use positive pressure room. Rationale. Protective isolation requires a positive pressure room to prevent pathogens from entering the patient's environment. 25. A nurse is caring for 4 patients. Which patient should be seen first to reduce infection risk? 1. A post-op patient with a fever. 2. A stable patient with stage I pressure ulcer. 3. A patient requesting pain medication. 4. A newly admitted elderly patient with no known infection. Answer. A post-op patient with a fever. Rationale. Fever in a post-op patient may indicate a surgical site infection and requires immediate evaluation. 26. A nurse is preparing to administer medications through a central line. Which step is essential to prevent infection? 1. Flush with normal saline before and after. 2. Wear non-sterile gloves only. 3. Disinfect the hub with alcohol for 5 seconds. 4. Change the 4 tubing after every use. Answer. Flush with normal saline before and after. Rationale. Flushing before and after maintains patency and reduces microbial colonization in the catheter. 27. A nurse is removing PPE after caring for a patient in isolation. What is the correct order? 1. Gown, gloves, goggles, mask. 2. Gloves, goggles, gown, mask. 3. Mask, gown, gloves, goggles. 4. Gown, mask, gloves, goggles. Answer. Gloves, goggles, gown, mask. Rationale. This order minimizes self-contamination when removing PPE. 28. Which practice violates sterile technique during a dressing change? 1. Keeping sterile items above waist level. 2. Touching a sterile field with a clean glove. 3. Opening sterile supplies away from a body. 4. Using sterile gloves to apply the new dressing. Answer. Touching a sterile field with a clean glove. Rationale. Only sterile gloves or tools may touch the sterile field to maintain sterility. 29. A nurse is teaching a student about infection control. Which statement indicates a need for further teaching? 1. I can use alcohol rubs after caring for a C. difficile patient. 2. Gowns are required for contact isolation. 3. Airborne isolation requires N95 masks. 4. Hand hygiene must be done before and after glove use. Answer. I can use alcohol rubs after caring for a C. difficile patient. Rationale. Alcohol rubs are ineffective against C. difficile spores. Hand washing is essential. 30. During an outbreak of influenza in a hospital, what is the priority nursing action? 1. Encourage visitors. 2. Discontinue droplet precautions. 3. Cohort infected patients. 4. Allow unrestricted movement of infected staff. Answer. Cohort infected patients. Rationale. Cohorting minimizes spread of infection and helps contain outbreaks. 31. Which patient should the nurse assign to a private room to prevent infection? 1. A patient with active pulmonary tuberculosis. 2. A patient with chronic back pain. 3. A post-op day 1 patient. 4. A patient on routine antibiotic therapy. Answer. A patient with active pulmonary tuberculosis. Rationale. TB requires airborne isolation in a private, negative pressure room. 32. Which finding indicates a breach in infection control in a hemodialysis unit? 1. Staff wearing face shields. 2. Patients seated less than 3 feet apart. 3. Gloves used during vascular access. 4. Dedicated machines for infected patients. Answer. Patients seated less than 3 feet apart. Rationale. Close proximity increases risk of transmission, especially with bloodborne pathogens. 33. A patient on neutropenic precautions wants fresh flowers. What is the nurse's best response? 1. Allow flowers if stems are short. 2. Encourage artificial flowers instead. 3. Remove water daily to reduce bacteria. 4. Flowers are safe with gloves. Answer. Encourage artificial flowers instead. Rationale. Soil and water in fresh flowers harbor bacteria and fungi, posing a risk to immunocompromised patients. 34. When providing care to a patient with methicillin-resistant Staphylococcus aureus (MRSA), what PPE is required? 1. Gown and gloves. 2. Mask only. 3. Gown only, for gloves and goggles. Answer. Gown and gloves. Rationale. Contact precautions require gown and gloves to prevent transmission via skin or surfaces. 35. Which of the following indicates correct use of surgical asepsis? 1. Turning back to sterile field briefly. 2. Holding sterile objects below waist level. 3. Avoiding talking over sterile field. 4. Opening dressings toward the nurse. Answer. Avoiding talking over sterile field. Rationale. Talking can introduce microorganisms into the sterile field. 36. A nurse is preparing a sterile field. Which of the following is appropriate? 1. Keep sterile gloves in pockets until use. 2. Use a sterile drape to define the field. 3. Apply lotion before donning sterile gloves. 4. Use alcohol wipes to clean field. Answer. Use a sterile drape to define the field. Rationale. The sterile drape establishes a sterile working area and maintains aseptic technique. 37. Which action by the nurse increases the risk of catheter-associated infection? 1. Hanging a new forebag using clean gloves. 2. Breaking the tubing connection without gloves. 3. Scrubbing the hub for 15 seconds before access. 4. Securing catheter with a sterile dressing. Answer. Breaking the tubing connection without gloves. Rationale. Aseptic technique and gloves are required when handling 4 connections to prevent bloodstream infections. 38. A UAP asks to help reposition a patient on contact precautions. What should the nurse do first? 1. Assist the UAP directly. 2. Ensure the UAP dons gown and gloves. 3. Reposition the patient independently. 4. Tell the UAP not to enter the room. Answer. Ensure the UAP dons gown and gloves. Rationale. UAPs may assist if they use proper PPE for contact precautions. 39. A nurse is administering an injection, and the sterile cap of the needle touches a non-sterile surface. What is the next action? 1. Continue using the same needle. 2. Wipe the needle cap. 3. Discard and replace the needle. 4. Inject quickly to avoid contamination. Answer. Discard and replace the needle. Rationale. Any breach of sterility requires immediate replacement to prevent infection. 40. A nurse is caring for a patient with chickenpox. What precautions are required? 1. Standard only. 2. Contact and airborne. 3. Droplet only. 4. Contact and droplet. Answer. Contact and airborne. Rationale. Chickenpox varicella is transmitted via contact and airborne routes, requiring both types of precautions. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.